may come on, Tom.
Okay.
But we just wanted to take a chance for you to, folks to get to see you more than the 5 minutes we saw you at the convention, and for you
Yeah.
to share the latest information because people are curious about that.
Awesome.
And thank you
Well,
for, we know you are busy, so we appreciate you taking this time.
this is what I'm supposed to be busy for. So I'm more than happy to be here
Okay.
today. So first, thank you all for engaging and taking the time today. I know everyone's got a lot going on, everyone's busy. So your commitment and engagement is really important to me and really, really valuable. Sometimes when you talk about complicated or difficult benefit changes and no one responds, you worry that no one's listening. I'm not worried about that with this group. So, as folks have questions, happy to hear them and happy to engage in this situation. So some questions were sent over. I'm going to start there, but I want to make sure this is as much a dialogue as possible. So if I'm not being clear, you got me recorded, so might as well put me on the record. Please don't hesitate with follow-up questions. And two, if there's kind of additional questions or specificity y'all want to get into, happy to do the best job I can. I will say, as a reminder for folks, the board is voting on benefit changes May 20th, so 2 weeks from today. But premiums will not be voted on until the August board meeting, which is on August 15th. So the benefit, we'll talk about what we suspect the premiums could be in May, but just know a lot of stuff can happen between May and August that will impact the number either up or down. I don't know how materially up or down, but I promise you it will be not the exact number on the page we talk about in May. We're just kind of showing like the directional impact of where we see the premiums going. The only areas that is not true is we can say with certainty for the non-Medicare retirees and the Medicare retirees, the 70-30 plan will continue to be $0.00, and the base Humana plan will continue to be $0.00. As just kind of just clarifying starting point. So before we kind of jump into the questions, I want to kind of jump into we've got some good guidelines about some myths and things. One thing folks heard or are saying or have heard, and it's not just retired, it is from actives as well, that if we had just stayed with Blue Cross Blue Shield, nothing would have changed. We wouldn't have required to have any changes from our benefits and the like. I will be the first to admit, I think there's been some challenges with the transition to Aetna. I would describe those as really operational challenges, though. The changes that are coming to your benefits are a function of a few different things, but certainly not the transition to Aetna. And for transparency's sake, I didn't work here when the decision was made to transition from Blue Cross to Aetna. So I'm not defending my actions. I'm kind of defending the previous administration on this one here a little bit. What really drove the changes, kind of in full transparency and honesty, is healthcare inflation is about 5.5%, 5.7% with medical and pharmacy. And because we haven't changed plan designs, changed cost sharing, or changed premiums for 8 years, we're taking in only about 3% new money every year. So the analogy I make is we kind of been living off credit cards a little bit. We had a pretty healthy reserve that has gone down over time. And while we have somewhere between $600 and $750 million in the bank right now, personally, I take 1% of that money and call it a career and retire. When we talk about a $5 billion health plan, that's not that much money in the scheme of things. It's just the amount of money we have now is really to pay the claims going forward. So the financial situation we're in, the changes in premiums are kind of due to a few factors. One, I would say we haven't done a great job as a state health plan in the past 8 years of having additional monies come in past the employer contribution increase. I do want to give the General Assembly credit where credit's due. They have funded, they put new money into the plan almost every year. If you look at the amount of new money coming in this year, proposed in the Senate budget, at least we'll cross our fingers that holds. That's a 5% more money than the previous year. We hear a lot about how the budget is challenged. So if you think about new money coming in, about 40% of the increase in revenue from taxes is going either to state health plan, offsetting state health plan changes, or to funding and paying for the retirement benefit. So the General Assembly continues to chip in. They've chipped in more this year than they have in any other year. So, again, totally acknowledge there have been challenges with the Aetna implementation and ways, and anytime something's new, there's gonna be challenges. I think everything is well intended, but it's just factually not accurate that we wouldn't be having changes to copays and prescription drugs had we stayed with Blue Cross Blue Shield. Like there's no math that this wasn't going to end the way it did based on how the previous administration chose to spend money. I will say Aetna does need to work on some of their operational efficiency, and we're going to continue to hold them accountable to that. The other big piece that really drove increases in premiums was the Clear Pricing Project. So if y'all aren't familiar with it, I'll just kind of do a quick step back on that. The previous administration offered what was called a Clear Pricing Project, which was in exchange for receiving 160% of Medicare, we would reduce copays to our members to go to use those providers. Was well intended to bring transparency and reward providers who are being transparent by having additional members steered their way. And that was projected to save about $300 million a year. What practically happened was all the folks that were making less than 160% of Medicare signed up so they'd get a raise. And then all the folks that were making higher than 160% of Medicare didn't sign up. So the savings that was projected to kind of cover the increase in spending never materialized. So rather than saving $300 million a year, we wound up spending an extra $150 million a year. So that's pretty entirely separate from the transition from Blue Cross to Aetna. I will say the Clear Pricing Project is going to be eliminated effective 12/31 of this year. We have some exciting stuff we think we're rolling out in its place, but it's really going to be focused more on just quality and access, not just simply paying doctors more money. We frankly cannot afford just to give folks more money, because every dollar we pay more to providers is going to come out of benefit design or premiums to members right now. So we're actually trying to go the other way of reducing some of the amount of money we're paying doctors for services and really focusing on quality. So kind of myth one there, I would just say, like, I can give you full certainty that the increase in premiums, the increase in plan essentials has nothing to do with the transition at all. I'm looking at the next question, a lot to unpack here. I'm gonna have to follow up on the question about the split retirees between non-Medicare and Medicare retirees, but we'll kind of follow up with that question. But I want to give you all a bit of an update. I'm going to go back to the Aetna point quickly. I think one of the challenges we walked into is folks were pretty used to Blue Cross for the last 35 or 40 years. And I'll say I think the folks at Blue Cross did a really good job. I worked here for 2013 to 2016, had a good relationship with Blue Cross folks, still do. We all got used to a certain way of things being done. And when you bring in a new partner, things are going to be different in some cases. And that's why there's different third-party administrators. That's why there's a Blue Cross. That's why there's an Aetna. That's why there's a Cigna. That's why there's Humana. They are all a little bit different. And we're still learning what a lot of those differences are in real time. And that, candidly is not ideal under really any circumstances. And we're trying to figure out where there are challenges. How do we fix those and hold our members as harmless as we can where appropriate? And some of the changes, candidly, are better policy in some cases than previously had under Blue Cross. There's some programs that Aetna has in place that try to steer members to lower cost settings first. That doesn't feel good in the moment when our members being charged more. And we're still trying to unpack what those are. So I would ask you all, as issues come up with your members, please let us know. And I know this is not a shy group. So as challenges come up, we're doing I think we're closing loops on when challenges come up as best we can. But the more we hear about them, the earlier we hear about challenges, you have my commitment that we'll try to be on top of them as best we can. But we really lean on our members for when they're having a challenge to let us know, and then we will go. I'm sure y'all have met Caroline and Beth in some capacity. They don't let anyone off the hook for challenges and problems. So when something arises, let us know and we will go full bore to understanding the problem. With respect to anything new from the Humana Medicare Advantage plans, I think y'all remember maybe this time last year, there was pretty significant concern that premiums on Medicare Advantage would increase dramatically. And that's set at the federal level. That has nothing to do with Humana or the state health plan. The federal government drives the kind of cost structure for Medicare Advantage plans. There's been a lot of uncertainty in Washington, D.C. about different changes in different ways. One area where we get some really positive news was around the Medicare Advantage space. So the premium increases are not as high as we thought they could be. So that is really positive news. They're putting more money into the Medicare Advantage plans across the country. So the cost the state health plan bears for those and the cost your dependents bear for those is not going to go up as high. What we're trying to think through and manage with the board now is, do we increase cost sharing in those plans, or think about how we administer those plans a little bit differently and in maintaining the cost share structure in place? We'll have a more robust conversation about that at the board meeting. We're still kind of getting board members up to speed on what all that means. I do feel reasonably confident your cost sharing on the Medicare Advantage plans is going to be minimal to nothing. We're trying as hard as we can to keep those low. I'm not going to promise you zero, but we're working really hard to mitigate the changes to on-plan designs from the Medicare Advantage plans. The premiums will go up for your dependents. The premiums will go up for the enhanced plan, but nowhere close to the amount that they were talking. Nowhere close to the $200 per tier that we were talking about in the past. Like we're in a much better spot on the Medicare Advantage plans than we had been previously, which is really exciting news. And in a time of a lot of uncertainty and bad news around costs and premiums and things like that, I think that was a really great thing that we're really excited about. With respect to retirees or non-actives under the age of 65, I try to lead off with the 70-30 plan is going to continue to be premium free for those folks. With that said, the plan design changes planned on the 70-30 and 80-20 plans for that population is going to go up at the same amount that the active plans are an increase. So I would anticipate deductibles going up. We're doing as best we can to maintain the out-of-pocket max, but the cost sharing across the board is going to go up in those plans. And in the 80-20 plan, the average premium increase is going to mirror the active average premium increase. So those things will look very similar, and at the board meeting, we'll have the same conversation about the actives and the non-Medicare, non-active retiree folks. And that, that reflects a lot of, issues with the kind of rising cost of healthcare. One thing where we'll always need your help on, we'll need your help with everything, just to be perfectly frank. But as we think about rising costs in the future, and kind of going forward, the Humana plan is a much richer benefit than the 70-30 plan from an actuarial perspective. And it costs about 10 times as much to administer over the course of the year, between 5 and 10 times as much to administer throughout the course of the year. So we're trying to create bigger differences between the Humana plan and the 70-30 plan. Because one, members, it costs the health plan a lot more. And it costs, generally speaking, there are a lot of members in that 70-30 plan that are literally paying thousands of dollars more out of pocket than they could be if they were in the Medicare Advantage plan. We have historically erred on the side of giving members a choice. We try to default folks in the Medicare Advantage plan. There are some folks where there's a good reason to not be in the Medicare Advantage plan. Get that, and I fully appreciate it. There are just a lot of folks in that 70-30 plan that are paying thousands of dollars more out of pocket. We are paying thousands of dollars more. And that's why you'll see some changes to the Medicare 70-30 plan, because we are continually we want to give folks a choice, but we do want to nudge those folks to say, hey, you're just going to save a lot of money in this plan. Your drug costs are capped. You have more flexibility to spread your drug costs over the year. Your copays are capped. It is just a more predictable, lower cost plan option. That really benefits everyone. And there is not a network difference because of how we've structured our Medicare Advantage plan. You can still see the same set of providers. The billing is a little different because it's Medicare Advantage, but the real kind of core issue we wrestle with, and I think a couple of our board members kind of struggle with a little bit, is do we keep offering the 70-30 plan, even though it is allowing some folks, while they might prefer it, like the look and feel of it and the name and the historical context of it, they're just costing, we see more and more money going out of their pockets. When we look at where the spend is going year over year, and they're just not as financially protected. I guess some folks, it does work better for it. Fully concede that, but there's just more folks than not are in a worse financial situation by being in the 70-30 plan, and we're trying to be helpful with that, navigate it. And like the health plan doesn't tell you which plan to pick. That is, we don't think that's our job, our role, and we can't predict your future healthcare costs. But as you think through with your membership and kind of really chatting with those folks, getting them to sit down with someone to say, let's look at what you've been spending money on the past couple of years and figure out if this couldn't be a better option for you. Because again, the premium is still zero. Your financial exposure is less. Because of some of the drug changes in the Medicare Advantage plan, if you have a really expensive medication, you can kind of pay it, not with no interest, kind of monthly or quarterly in a little bit different way than the 70-30 plan. So that would be, one ask is please continue to communicate out with us whenever there's a challenge. Thomas.friedman@nctreasurer.com. If there's ever, please reach out to me directly. And two, helping your folks understand where they have a chance to save some money. We want our members to have as much money in their pockets as we can, given the kind of environment we're in. And there is a very clear path towards it, and we just want to make sure our folks know that. So I talked a lot, and I'll pause if there are follow-up questions or comments from folks. Want to make sure you all have room to talk as well.
I have a question.
Yep.
I'm very new to Medicare. I turned 65 at the end of March, and I've gotten so much information. It's really overwhelming. I've never retired before, so it's all new to me. I did get a Medicare Advantage plan because that's what I kept hearing and was told by a couple of sources. And once I did, I called just to check to see what my status was, and they told me that my Humana had been terminated. And I didn't even know when I called. I'm a retired educator. When I called the county to find out about, before that happened, to find out what was covered by Humana, she only told me about Medicare D. So again, Medicare Advantage, Medicare C was what I kept hearing. So once I did that, they said that it was terminated. However, they did reinstate it. So, and she said that was all I needed to do in terms of having the Medicares that I needed. But I just wanted to ask the question with B, and I'm still learning these alphabets and what they go to. B and C, is it necessary to, if they're covered by the state, do I need to have B and C covered also by the federal government? I don't even know if that's a stupid question, but.
No, it is a great question. You are not the only person to ask it. It is confusing because it's confusing. You do need to purchase Part B. Medicare Advantage is technically a Part C, but to be eligible for Medicare Advantage, you do need to purchase and pay monthly for Part B. So for the folks, and one of the draws of the 70-30 plan is you do not have to purchase Part B. You will be in a not great financial situation if you make that decision, but it is, that is partially why it's there for the folks that haven't gotten Part B yet. But Part B is required for Medicare Advantage. I'm not an insurance broker, so I'm not giving anyone advice, but you would be putting yourself at significant financial risk if you do not have Part B. And that is something that is not covered by the state or the state health plan. That is something that has to be purchased separately.
Okay. So the Part B, I was thinking I had that, but if I don't have it, with the Part B, even though I received my Social Security, if the 180 or the amount that comes out for that, is that not what that is, or for Part B?
I'm gonna defer to Colleen on that one. That sounds like the right number.
Yeah,
Yeah.
185 is correct. And you probably you can talk to me directly later, Bree, but you probably just need A and B.
Okay, all right. Thank you all. I appreciate it.
Of course.
Well, also, the other thing is that the prescription drug plan, you don't need to buy a separate plan, because the prescription drug plan is included with the Medicare Advantage.
That's correct.
And so I had a friend one time that actually purchased a separate plan, had I think it back then was United Advantage plan, and she couldn't figure why they weren't, giving her any benefits, because if they couldn't, because she already got the benefits of the plan. And she ended up like paying $50 a month and got nothing out of it. They just ripped her off.
Oh, wow. Okay.
Yeah, and
Thank
yeah, the broker space and the other folks that kind of deal on that secondary market on Medicare is a squishy space, to be perfectly honest. I think there are a lot of bad actors out there. But we do, to Linda's point, our Medicare Advantage plan does cover your drugs. Our 70/30 plan does cover your drugs. Like those are both included benefits as a retiree. There are sometimes reasons in the 70/30 you could want to buy supplemental coverage, but it works very confusingly with the Medicare Advantage plans, and a lot of times you're paying for something you're not going to get value out of.
I have a question.
Okay.
My husband and I have TRICARE for Life as our tertiary,
Mm-hmm.
and I have surmised from the research I've done that Humana would not coordinate with TRICARE the way the 70/30 plan does.
Yeah, so
That's why we've stayed with the
That's right.
70/30.
That's right. Yes, and there the folks in that you're in one of those groups. There's some federal employee groups as well that y'all are the and that's why it's not for everyone, but like y'all are the folks why we've maintained the 70/30.
Okay, so we're not coming out at a disadvantage staying with the 70/30 versus going with Humana.
Generally speaking, probably not. You're
Okay.
probably doing the right thing. Yeah.
That's reassuring. Thank
Yeah.
you.
I have a question, but I don't know how to put up the little yellow hand. Is it okay if I ask?
You got the
a question?
floor. Yeah, you got the floor.
Yeah.
Speaking about 70/30 plan, I'm with a supplement with it, a supplement G. How does
Oh.
that coordinate with what you've been talking about with regard to Humana Advantage plan?
That would be please call Humana and talk to them. They'll with the separate part G plan. Since we don't administer that, and that is the interaction with that is something. Please, we can get you some folks at Humana to speak to directly on that. But I don't want to misspeak on that one, so I would speak directly with Humana. If you want to reach out to Beth Horner at the State Health Plan, beth.horner@nctreasurer.com. She'll get you to the right person at Humana to make sure you get what you're looking for. I'll put that in the chat.
And Linda's hand is up, Tom.
Yep. Hi, Linda.
Hey, you did kind of touch on brokers, and I know we have one local where a Medicare broker is actually a member, and talking to the members and many times steering them away from the state health plan. I had another member that signed up because it was some friend of hers from church that advised her to take this policy, and then she ended up driving from Rocky Mount to Greenville just to go see a gynecologist, and she wasn't getting the benefits that she needed. And we finally convinced her to switch back to the state health plan and I guess to Humana. But what can we tell our members when they get in a situation like that, so they can basically protect themselves and be knowledgeable, with maybe calling the state health plan to verify, what the state health plan or Humana could provide for them before signing up with some broker, because the broker's in it for the money.
So our comms director, Beth Horner, is here, and I think she's got a more eloquent response to this one than I do.
Hey, Linda. So what we usually tell members is before they do anything or they have any questions that they need to call our Eligibility and Enrollment Support Center. That number's on the back of their cards. It's the 855 number. If you're also looking and shopping around at anything outside of the state health plan, the DOI's SHIP program is also where we defer a lot of members because they are very well educated on all plans, not just state health plan, but they can really help members navigate the different options outside of the state health plan, but they also are up to speed and educated on state health plan offerings as well. So we always tell people to not enroll or do anything until they either contact SHIP or contact the state health plan's eligibility and enrollment support center so we can make sure that it doesn't mess up anything with your state health plan coverage.
And not to hijack this, but I know that there is some proposed cutting of funds for SHIP. So we probably need to do something to get that word out to our legislators that we need to keep that because it is beneficial.
And it's very, yes.
It's a
Yes.
tremendous service and they're great. Services.
We'll work on that, folks. Everybody, we're going to do our emails.
How else can we help y'all? We can happy to share as much as we can. And these questions are great and helpful, and we just want to make sure y'all have the time and space to ask questions.
So you may not know the answer right now, but there was that question about folks who are just going on turning 65. Will their pay half of it because they were hired after 2006? Would their cost be 276, or does that depend on what the new premiums are?
It would be it would depend on what the new premiums are. Yeah.
Okay. All right. Okay.
So Humana, I'm
Oh,
sorry.
I'm sorry. No, go ahead.
I just wanted to clarify. So Humana covers C and D for retired educators. Is that right? Or am I
No.
wrong? Okay,
Oh,
it does
Say that
not.
one more time.
They do a prescription drug, so you
Yes.
don't need D.
Right.
Yeah.
Okay.
Yeah.
Okay. Thank you.
Okay, I think Lee
Yeah.
Berger is in her car. He texted something in. Lee, can you actually like speak into your phone and, I need to look at the chat about what your question is.
Actually, I can. I just got,
Okay. There you are.
well, I wrote it in the chat. I've been on the 70-30 plan, whether it was Blue Cross or Humana or whoever we've had. But a lot of people talk about, well, do you have schedule XYZ? And I've never taken anything else because for me, the 70-30 has been fine. And I'm just like, well, is there something more I should take? I know dental insurance is not part of that, but I can't do dental insurance because my dentist office won't take that or whatever. So sort of convoluted question, but do we need anything more than 70-30? That's what I push when people ask me because it's been a pretty good plan. But then my
Was it-
second has to do with going to a doctor's office, and if it's specialty, it's $40, and half the time you see the PA, and I'm still paying $40 for a PA as I'm paying for an MD, and that just may be an issue that's totally unrelated.
So I would say in general, this is in general, and like we mentioned with the TRICARE folks, and then or folks that have very very few claims. Generally speaking, the Humana Medicare Advantage plan is a richer benefit than the 70-30 plan. But everyone's situation is unique. I would say 7, 8, 9 times out of 10, somewhere in there, the Humana plan is better for folks. Assuming they don't have TRICARE for life, assuming they aren't part of getting certain federal benefits, it generally covers more of the cost. That is something I would think about like on an individual basis. But happy to kind of like there's calculators kind of set up we can kind of like talk through like how your past experience has been. I think if something really catastrophic happened to you and you weren't part of a TRICARE plan, The Humana plan almost certainly will cover more of the expense on your behalf because your out-of-pocket cost is thousands of dollars lower. So no one wants to get hit by a bus. If they did, that's just a much better option. With respect to your second question, the copay is not necessarily geared to whom you are seeing. It is the classification of the type of visit you are seeing. So I generally speak, so when you go and if you see us for a specialty visit, it is for the specialty visit, not necessarily a specialty visit with a doctor or a PA. It is just for the specialty visit and like the type of specialist you're seeing. I get and appreciate that is exceedingly frustrating. My wife has articulated the exact same concerns to me when she has gone to the doctor in the past. So while I appreciate it's frustrating, the copay is not to see a doctor, it is to have a specialty visit. And you could have very good faith arguments both ways that like, yes, I should be seeing a doctor, and we are limited by our influence in that structure there. I would just say, generally speaking, when I've had to see a PA versus a doctor, it's because I'm not sick, but that is, again, that is a one-of-one experience, and I'm one of 775,000 people on this planet. So again, it's for the visit, not necessarily for whom you see at the visit, but I do appreciate the frustration there.
I want to mention something, that she's saying she's got the Humana 70/30, but her benefits appear like she's got the Humana base plan.
If you have the Humana, yeah, it's richer than a 73. If it's through Humana, it's Medicare Advantage. If it is through Aetna, previously Blue Cross, it is a 70/30 plan. It's like the kind of delineation.
And see, that's what I think that a lot of our members get mixed up, and that's what happened after you left at our convention, because it seems like the Humana base plan that is free should be called Humana base, and then you've got the enhanced plan, which you have to pay something for, and I think, and then they're saying that's 90/20, and I just think it confuses people, but we can talk about that later. But
yeah, you're right, and so we are the names are going to have a tweak that we're just trying. We do feel like we can do a better job clarifying those. And so the base plan will be the Humana plan, and we're gonna keep the name 70/30 for the Medicare retirees. Is that correct, Beth?
Yes.
So we know we got some work to do on the names, and we're trying to think through the communication to better articulate exactly what you're talking about, because we don't disagree that the names could and should be better. That's what we're gonna start rolling that out. And I think we'll go with you and Colleen as we get closer to voting to help kind of with structuring the communication to make it more clear, because you're 100% right. I fully concede it's a little bit confusing now.
Beth, could you give us the phone number for the eligibility center?
Yes, it's 855-859-0996.
Great, thank you.
I put it in the chat for folks too, if you didn't catch that. I'm slow on the uptake on numbers. So
Call, they are very helpful, and there's not a real long wait to get on to talk with somebody.
you told me to talk to Beth too. But
Right, that's right, yes.
Um,
Lee, that's the number for the state health plan, if for eligibilities or like customer service questions,
Yes.
Isn't that on our card?
Yes.
I have a question, if I
Shoot.
could. Marie
Yeah.
Hurst. My health plan is set up fine. I retired several years ago, and Humana was what the state moved me into, and the Advantage plan, which is great. I have no complaints at all. My husband is just turning 65 this summer, and he will be getting Medicare, and he's a state employee. So will the state just automatically enroll him into Aetna? Because he's in Aetna right now because he's an active worker. But will they just put him in a Aetna Medicare plan when he retires? How does that work? Or can he choose Humana over that? Or how does that work?
So are you the subscriber? Is he on your plan?
No, he's his own entity
So
there.
they go from 0.
Oh, yeah, so we're gonna automatically enroll him into the Humana, base plan. And he can opt out of it if he wants to, or pick the enhanced plan. We're gonna automatically enroll him.
Okay. And that you'll let him know that's going to be happening. Does he have to do anything?
No,
Get Part B.
he'll get a letter,
Okay.
and to make sure that he gets Part B and when he should get Part B.
Okay. So
Yeah,
that will
he's got to enroll in Medicare. That's what he's got to be sure to do.
So, and does he go online somewhere to do that with
Yes, you go on Social Security.
Yeah.
okay, I see what you're saying. Okay.
Yep.
Mhm.
All right. Okay, thank you.
Or call them and get an appointment.
Right.
So I just want to add, for anybody that is like contemplating retirement or getting ready to turn 65. So the state health plan, we have a couple of customer experience specialists that do webinars on a monthly basis, and they cover all the things. So it's like a 2-hour, way more information than you ever want to know, but like it gives you a step-by-step of all the things. So if you go onto the state health plan website, you click upcoming events, you'll see some of their webinars, and we offer them throughout the year. And I would strongly encourage people in that situation to register for one of those.
Thank you, Beth.
Uh-huh.
How do
She
you
gets the hard
register?
question.
How do you register?
When you go onto the website and you click upcoming events, you'll be able to click on it and you can register for one of those.
And what is the website?
It's shpnc.org.
We could put some of this stuff on our website too, put links. We're gonna get some numbers and links. So members could just go to our website and link exactly what they need. It's another way. Any other questions? If not, I've got one. Let me just ask this. I have heard about people like leaving, like say the Humana plan, and taking something completely not offered by the state. And then they want to come back because they learn and they get a doctor's appointment or getting their prescriptions that there's problems. And I thought there was a limit to how many times you can leave and then come back to the system. You know, meaning come back to the benefits of the state health plan.
If you're not aware of a limit, you just are limited on when you can come back, which would be during open enrollment.
So if you're off until for the year.
Yeah.
And then you can come, you can always come in, it's your benefit.
I think what you're talking about is during the Medicare enrollment period or disenrollment period from January to March, you can only make one change. I think that's what maybe you're talking about, and that's the CMS rule from January to end of March every year.
Mhm.
Yeah, it could have been that the person didn't sign up during open enrollment with the state with with Humana or the 70/30 plan or anything. They went with somebody else that their broker convinced them to take, or they listened to Joe Namath on TV. And so then they discovered that it wasn't working. So then if there is that open enrollment period at the beginning of the year, and they can do one time and they can switch back.
Yeah, I would just reiterate, and if you guys can spread the word, listening to a broker who is going to profit from whatever plan that they put you in that's not the state health plan is probably not the best advice you can get. I mean, they're very helpful in a variety of different ways.
Yes.
But please tell people to contact the state health plan before they do anything, because a broker is more than likely not going to understand the state health plan rules and what our plans are. And our plans are completely different than what you can get from Joe Namath. So, I mean, it's just really important that people, you know, you can, like someone said, they're inundated with information when you're becoming Medicare eligible, and you are. I would just make sure that people take advantage of what we offer in terms of webinars and the support that we give members to help them understand, so they don't get themselves into something that they can't use.
That's right. Yep. Yes, we say Tom Selleck and Joe Namath are not your friends. Anybody else got a question?
Yes, Miss Lanier, this is Bree Cowan. Am I able to get in? You said to speak with you later. How do I get in? Just email you?
Yeah,
Okay, all right. And it's, what is your email?
I'm putting it in there.
Okay, thank you.
There's a question in the chat someone asked, and I think Tom said that automatically people go into Humana, and the person said, did you say Aetna? So
No.
did you say, you said Humana, right?
Humana.
That's what I thought.
As long as you have Part B.
As long as you have Part B.
Yes.
Yes, okay.
Got a clarifying question.
Okay.
Retirees, non-Medicare eligible, they want to be in the state health plan. Are they going Humana or Aetna? Or do they have a choice?
Non-Medicare is only Aetna.
Non-Medicare, only Aetna, under age 65.
Correct. You got
Okay.
it.
Retirees, 65 or older, Medicare eligible, they go automatically into Humana.
Automatically in Humana, they can opt into an Aetna plan.
But they are enrolled automatic. And from what I've heard today, because there again, it's been in and out,
Yeah.
the Humana base plan, we will call it now. I thought it was the 70-30, but I've just learned that apparently 70-30 and base are two different things. So what are the numbers for the base plan? 80-20?
Much closer to 80-20,
Yeah.
85-50. The base plan is much richer than 70-30 plan.
Where on my card would it indicate that I'm on base plan or whatever?
Is your card say Humana or Aetna?
Humana?
Then you're on the Humana base plan.
Well, that's
Are
what
you
I
paying?
thought.
Yeah.
But I would keep on hearing 70-30 all these years.
Yeah. No, that is the non-Medicare Advantage plan.
Okay. Fine.
That's why we got some work to do on the name.
Sorry that are going to ask me
No, you're good.
correct information.
Yep. That's a good
And
question.
Tom, Linda and I have said this to you, but we wanted to share also, if we had a wish list, it would be hearing aids, low cost hearing aids that work. That's what people say. So,
We're trying. I'm
we
with
figured
you. No.
What'd you say?
They're trying. The $500, like for basic 2 hearing aids, is just not enough. Even Costco, I heard, is going up, like they're charging $2,000 now.
Yeah.
How about your partner Pierce Insurance? How about their hearing aid program?
I can't speak to that. I don't know anything about that, to be perfectly honest with you.
Yeah, I might actually, I'll check on that. I think it might be just 500. I checked with everybody a couple of years ago, and but I do have that plan because it's like dental, vision, and I think it has hearing too. Okay, so we maybe just so we know.
Well, thank you so much for taking your time. We just hang in there and do what you can. We know that you are doing 2 or 3 things at a time. So we appreciate you taking time for us to be one of those 3 things.
Appreciate y'all, and I appreciate the questions. Thank you. Like, our doors are always open for questions. So this isn't the last time I hope to get to chat with y'all. So thank you so much for your time.
Thank you.
Thanks a lot.
Talk soon. Bye.
Okay.
Thank you so much.
Yes, thank you. And thank you everybody for joining us today. And it is going to be taped, and we know the sound is not great, but that's because of Zoom probably or something. Don't know what it is.
Thank you so much.
Thank you.
Okay.
Bye-bye.
Okay.
With
Bye.
gratitude. Bye-bye.
This was like a record attendance. I mean, I
It's
don't think
good.
we've ever
Very
had
good.
72.
It is.
Yes, this is great. So sending it out several times, Carol, was a good idea.
Mhm.
Good.
Hope you stop the recording.
Yeah. Have you stopped the recording?
Yeah.
Have you stopped the recording, Carol?